This is the Big Ideas Theater at AARC. I'm Ed Highland. Thanks for joining us. And thank you, too, to Dr. Errol Berlinski, who is with the UAMS College of Medicine, for joining us. Good to see you, sir.
Well, thank you. It's a pleasure being here today.
We're talking about cystic fibrosis and inhalants, things that perhaps would help them. And in particular, let's start a little bit in talking about, say, the availability of devices as well as the durability of devices.
Yeah, so this is a very important topic. In fact, I recently was lucky enough to participate in a survey of different providers and families about their perceptions and also their ability to secure these devices. And we sort of found several things. We found that it varies completely whether you live in one state or another state. It also depends on what type of insurance do you have. And this is sort of challenging because these patients might be doing 2 or 3 or 4 different medications. They require having devices that would last for several months. And in many situations, they might just get one for 6 months or maybe 2. It also varies if you're an adult or you are a child. So in my case, I'm a pediatric pulmonologist, and I think children usually are a little bit luckier in the sense that it's easier to secure those devices. Durability is critical, and the issue with compressors that power nebulizers, it's been a problem. And in general, compressors are built for treatments, 1 or 2 treatments a day. That's sort of the typical treatment for asthma. However, when you are doing treatments 2 or 3 times a day, and you're doing 2 or 3 treatments each time, you can imagine, like any device, will just have a shortened life. Part of the problem is always the reimbursement, where it's harder to probably convince companies to build more durable and more expensive devices, because in the end there will be a hard time getting reimbursed. So that's a problem.
So, I mean, obviously, if with the restrictions, if you will, of devices having the durability and the ability to be used many more times than they originally were intended, that obviously that would have to increase the burden of care, would it not?
Yeah, so the issue of burden of care for these patients, it's a significant problem, and in fact, it's one of the reasons where the adherence to some of these inhaled medications is not as optimal as we would expect. And families tend to maybe mix drugs together that were not meant to be put together in the same nebulizer cap. And I think that's the role of the respiratory therapists in educating the families of patients about the proper use and proper disinfection, and that's an important topic that I would like to get back to it in a minute. The role of the therapist, I think, is crucial in educating the families about what these drugs do for them and what are the possible side effects of these drugs. So then the family, and I guess I'm always saying the family, it's my pediatric bias.
Pediatric
but
family,
yeah. So, but the adult patient will know what to expect, and I think this is very important. We all had been patients at one time, and we like to know what's going to happen. It decreases the anxiety that is associated to taking any medicine, or probably the development of a side effect.
One of the concerns, obviously, with extending the life of a nebulizer or any device like that is disinfecting, cleaning, the maintenance.
So in the case of maintenance, I think one important key point is making sure that the filters are changed as recommended by the manufacturer, And there's a very easy way of testing each visit whether their compressors are working properly, just by asking how long these treatments are lasting. So as the compressor starts not working well, the nebulizer time is going to extend. So that's a quick way, without requiring technology, to quickly assess whether a compressor might be malfunctioning. And if you think that your compressor now, your treatment takes, instead of 15, it takes 25 minutes, the likelihood that you will cut it short or might not do it, goes up. So I think that we have to be vigilant about it. In terms of disinfection, it is a crucial point for patients with cystic fibrosis. They need to clean the nebulizers each time after use, but they also have to do a daily disinfection. And for that, there are two different methods that have been recommended to do it. One is what's called cold methods, and this is with the use of hydrogen peroxide or 70% isopropyl alcohol. And the second one are heat methods, and those is by boiling the devices, putting them in the microwave. They're just baby bottle sterilizers that people have used. And I think that different people use different methods, but as long as you are doing it, it's fine.
Does it get to a point where you as a physician have to step in and say, okay, because this patient needs this kind of care over this length of time, then he or she is going to need additional devices? So, you know, you have to make the pitch to the insurance company to try and get these devices? So,
in some situation, yes. I told you that I just work at a children's hospital where it's easier to sometimes the hospitals end up absorbing some of that cost. But yes, we just spend quite a lot of time writing letters of medical necessity, just stating why it's important that these patients have a system that will allow them to stay healthy and not be hospitalized. So sometimes that helps us in securing more devices for these patients.
You have to be the advocate sometimes.
We are just that. I think that that's a crucial role for the whole care team, both respiratory therapists and physicians, in just trying to make sure that they have access to the medications that they need in a timely fashion, and trying to educate them in how to use them properly.
Dr. Berlinski, thank you so much for coming by and sharing this very important information with us.
Thank you.
This is the Big Ideas Theater at AARC. I'm Ed Hyland.